Produce a one-page handout that frames a hip fracture as a bone attack, a warning event like a heart attack, explain why starting treatment matters now, use warm, non-alarmist tone, and end with 3 questions to ask your doctor. All right. So you can already see that there's a big contrast between these two prompts. And this one is starting here, but we're going to put my other one in and we'll revisit these two as we go through the presentation. But if it's not obvious, one is a simple question with no specification of the desired output, and the other is giving you context. Now we're telling the AI tool that I'm a orthopedic trauma surgeon, all right, and that this is a patient education type of task. We are specifying the audience. In this case, it's going to be patients. It's not a doctor that is going to have to learn about hip fractures in this case. The role, we gave the AI a role. We said, you are a patient educator. Compile all of the evidence and the knowledge you have about being a patient educator and use that to construct your output. And that's the other thing is I have seen so often people just not specify the output that they want in the way that they want. One of my pet peeves, and I've got a close friend who does this, I don't like the way AI does X or Y. That's because you're not iterating with the tool. It's not that you don't like what AI is making, it's that you don't like what AI makes for you because you're giving poor instructions. And I think that in order for you to maximize these tools, you have to be willing to suppress your frustration and follow a framework that's a lot more specific. So context, audience, role, and product. There's a ton of acronyms you can use for how you decide to remember what is the best composition of a good prompt. But I also kind of think of it like,